My name's Dr Euan Mackinnon and I'm from Scotland. And I'm here today to talk to you about dermal fillers. Just kidding. It's me, Dr Sarah Tonks, as if you didn't know. Euan couldn't be here today, so I'm filling in. That's right, lucky you. Our patient today, Charlotte, age 50, looking to do a little bit of zhuzhing up. Now, we have had her on the channel before, so let's just remind ourselves of her before and after pictures. Okay, let's go. I'm Euan Mackinnon.
You're right.
I'm Dr Euan Mackinnon.
Are you?
Yes.
Dr Euan Mackinnon, I
Who are you?
presume.
Yeah.
Dr Mackinnon, I presume.
I'm Dr Mackinnon, not yous.
How do you?
What do you want, mate?
Come on, Charlotte, let's have a look.
And here we are with Charlotte. Now, some of you may remember that she was on the show about 7 months ago, and we did some treatment. We did PRP around the eyes, we did some Botox, and we did some fillers as well. So 7 months later, ta-da, this is what she looks like. A lot of people do ask about how these things look as you go on. Well, here we are. So what would you like to do now? What's the plan? What ails you?
I think a bit more eye stuff is probably would be quite good. I'm feeling like the PRP was brilliant, and maybe it's time to top that up a little bit. I've just noticed the last kind of couple of months, maybe it's getting a bit funny again. I've never been a big fan of this hoodie eye thing, and I'd quite like to do something about that. And a bit of a top up all round, particularly the old lip.
Yeah.
Because I was a bit scared of that before.
Yeah.
And I know you were saying, go, do a bit more, and I was terrified. But actually, I wish I had.
Yeah.
No.
Well, I think that often happens. People are a little bit nervous about having their lip done, which is understandable, you know, the images that you see on the media of these overdone lips.
Yeah.
But yeah, I definitely think that you could go a little bit more, a little bit bigger. So I know we've spoken about doing some plasmage on the upper eyelid.
Yeah.
Which is something that we haven't shown on the channel yet, so that's going to be new. So that's going to be for tightening of the upper lid, and then we were going to repeat the treatment underneath the eye that we did before, which was the PRP, which worked really well. I have
It was
to say.
great. Yeah,
I was
really
pleased.
great.
Really
I was
pleased.
so happy with that.
Yeah.
Yeah, I'm a little bit nervous about the Plasmage. I'm a little bit nervous about all of it. I think it's maybe quite good to be nervous.
Well, I think that definitely makes sense because it's quite an intense sort of treatment to have done. There's, you know, a bit of downtime with that. I mean, as there are with all of these treatments, but it's a little bit more intense than maybe the things that you've had done so far. But you can't make an omelette without breaking some eggs, as they say.
Exactly, and I think the last time there was a little bit of downtime afterwards, and I hadn't quite anticipated that, I don't think. But within 4 or 5 days, I could totally see the benefit.
Why don't you tell us a bit about that? So what was the downtime like last time?
I was surprised by the amount of bruising, I think, and that was entirely my fault because I hadn't read the email that you sent out saying don't take ibuprofen, and I'd taken masses for a bad back for about 2 weeks. And I got a bit of bruising around here where you did the fillers and a little bit here. And in fact, one of the bits here lasted maybe about 2 weeks, but it was reasonably easy to cover up. The first day, I think I showed you the pictures. I had a bit of a Mickey Rourke jawline going on, but luckily that was gone by the next morning. But it was a little bit scary for a little bit. And I think by about the Wednesday, I had it on the Sunday. I think by about the Wednesday, I felt pretty confident to go out without makeup and stuff. But I did on the Monday kind of tell people at work, this is what I've had done, because I felt quite self-conscious that my face looked a bit weird.
Well, it's brave of you to tell them. Let's have a look at your pictures. So what we were speaking about was this little bit of pooching right there, just above the eyelid. So it's not going to go away completely, but I definitely think we can make an improvement there. Just out of curiosity, when we did the Botox before, was there a difference in that eyebrow position, or was it pretty much the same, do you think?
I'm trying to think. I think it was a bit lifted.
A bit. I can't remember now.
I think it was. I mean, I think the overall look was just so much fresher anyway that it was almost, for me, hard to tell what had actually happened. I just looked better.
I think that's often what people say. And then these little lines just coming down here, were they improved, you think, when you did the PRP?
massively, because it just filled everything out a bit, because I'm a bit sinky, and it just stopped the sinkiness.
You only had one?
I had one, and it was amazing.
Was interesting. There is a little bit of hollowness there as well, so I'm just wondering whether or not Euan's going to want to do a little bit of filler there as well.
Do you think my skin's going to be all right with the filler?
Maybe, yeah, because it's a bit thicker.
Yeah.
Now, so maybe I will ask him what he thinks. You could also do a little bit here as well for some lifting there, which would be quite nice.
For the cheek? Because you did that last time, and that was maybe the single thing that had the most pronounced effect for me, that I could just suddenly see that hole, and it was great. Yeah, it was really good.
And then with the lip, the difference that you had last time, would you like it to be that subtle again? Is that the plan?
I'm happy to be a bit braver.
Oh,
I'm happy to go a little bit bolder. You know my fear of the sausage. I don't want the sausage. Yeah. But yeah, I'm happy to go a bit more.
Okay. More. Okay, well, let's just take a quick look at you from the side, I think. So then from the side, this little bit of jowling that we've got going on here. I think when you do the cheek injections and a little bit in the temple, you are going to get some lifting. But maybe if we could do some fat dissolving injections there, that might help to just snatch your jawline significantly. And then this bit here as well will be improved when we do the lifting. And I think that's sort of the main two things. I will have a conversation with Dr. Euan about that, just to make sure everybody's on board. But I think it's a smart thing to do.
To get rid of that line. Let's do that, yeah.
So the fat dissolving you've not done before, there is downtime with that. It's swollen for about, quite swollen for about a week, and then you just look a bit fat for another week. And then it takes probably about a month for it to completely go down. But the worst bit will be in that immediate period after you've had the injection done. But if you're doing the Plasmage...
Exactly. I'm not going to be looking my best anyway, am I? So it doesn't really matter.
So you might as well, actually, just do it, I think. Yeah. So it's not me doing the treatment, but let's go and have a look at what Euan does.
Thanks, Sarah, but I'm nothing like that. So to start off Charlotte's treatment, I placed some local anaesthetic around the eyes. This is to make the eyelids numb for her Plasmage treatment. We then start with the fillers, and I use Juvederm Voluma. I place 0.7 mils in each temple, and then move down onto the cheekbone area and place 0.3 mils on each side in structural boluses. I then continue on the cheek area with 2 further mils of product. I then move to the alar base, or base of nose, and place 0.2 mils in a bolus on each side. We then treat the dorsal hump in the nose and the tip of the nose with 0.6 mils of product. I now switch to Juvederm Ultra 4, and I treat the pre-gel, marionette, and commissure zone with 2 mils of product. I now switch to Juvederm Volift and treat the sub-cheek area with 2 mils of product. It's back to Voluma again, and I do the chin crease area and tip of chin with 1 mil in total. I then switch to Juvederm Volbella and treat her lips and oral commissures with 1 mil. I decide now to move on to the Plasmage treatment. If you've not seen Plasmage treatment done before, you will probably see that there are little burns being left on the surface of the skin. Now that gives instant contraction. However, the contraction will continue to improve over the next 3 months. I now move on to Redensity 1. Now this product is a skin improvement product, and I'm aiming to get some tightening and brightening of the skin under the eye. And to finish off, we use some Botox in the upper face and the bunny lines. Okay guys, welcome back. We are with Charlotte 6 weeks after her treatment, and it's lovely to see you.
Nice to see you too.
So tell me, how did it go?
It was good. I had been really nervous about the pain for the with the Plasmage before, and it was a real relief that you did some local anaesthetic, like injectable local anaesthetic, so that was great. So there was no pain. I didn't feel anything. And in fact, the Plasmage was fine.
Yeah.
It wasn't that it wasn't too much swelling afterwards. I'd read a lot of things that were telling me it was going to be 2-3 weeks before the scabs came off, and then another 3 weeks of red skin, and it just wasn't my experience.
Great. So with regards to Plasmage, you may have seen in other videos that some people swell a lot after the treatment and other people don't have any swelling really worth talking about at all. So luckily for Charlotte, it was how many days?
Probably 5 days before I felt like I could go out without having to make an excuse while I was a bit puffy.
Yeah.
But all the scabs had come off by then as well.
Perfect.
So it was pretty good.
5 days of downtime versus like a blepharoplasty where they remove the skin surgically and you have a couple weeks off work, black eyes, things like that. I don't know, it's each to their own with what they choose, but did you find that this suited you better, I suppose?
Yeah, it was good. And in fact, I didn't have 5 days of downtime because I ended up having to work and do a couple of other things and be out and about. And it was actually fine.
Good.
It really was. I just wore dark glasses. And it was only really slightly pink after the scabs came off. So I think I was quite lucky.
Good. Perfect. So tell me what other aspects of the treatment, we've touched on Plasmage, but what other aspects of the treatment do you think have made a difference to you when you look in the mirror?
Well, it's hard because I had so much done at once to pick out the specific different things, I think. For me, when I had something previously, I'd never had anything on my nose. And I know you were saying, yeah, go for the nose. So I can't see I can't see what you've done, but I know that something is different and my face feels my nose feels like a bit shorter, which is, it sounds really weird. I don't know, the proportion seems to have changed a little bit.
Okay, so it's hard to look at your own profile, of course, because we can't see ourselves like that in the mirror. But what I did do for your nose, from the side you had a bit of a bump, so I smoothed that over so your nose now appears straight, okay? And then I worked on the tip of the nose and at the base of the nose, and I rotated things up and backwards slightly because over time, some people will experience a little bit of a drop of the base of the nose and a contraction of the chin, which shortens the lower part of the face. By stretching things out, lifting the nose slightly and elongating the chin, we balance the proportions and they look more youthful. So it's good that you've felt it rather than had to see too much of an obvious change.
Yeah, definitely. I mean, the other thing that I really liked is, and I don't know what you did under my eyes, but you did something there. And it just, I always feel like under my eyes is a bit sinky and a bit liney, and it's made a really big difference.
Yeah, so we worked on your tear trough, the under eye hollow, with very light dermal filler. It was more for hydration and a little bit of skin contraction. So I'm glad that it's made you feel, what would you say, more fresh? Or
yeah, I think so. I mean, that was, in fact, day 3, that was like perfect. That bit of my face looked like I was about 15. And I was like, brilliant. But it's changed. Like, I guess that was swelling, a lot of that. It's changed slightly since then, but I'm still really happy with it.
Good,
yeah,
good.
It's really good.
Are there any parts of the treatment that you found more difficult to heal from, or you found were unexpected afterwards?
I think there was one bruise here that I hadn't expected, and it was like a dark streak, literally sort of there, that lasted maybe 4 or 5 days, and I thought, oh God, it's going to go on for weeks, because you know what a black bruise can be like sometimes. But it wasn't. That was gone after 6, 7. In fact, the day I was going, it's never going to go. The next day, it was kind of almost gone. Perfect. It was weird, but yeah, that was a bit annoying, I think. And I mean, my face was a bit puffy and a bit weird, particularly days kind of 1, 2, and 3.
Yeah.
But I kind of had expected that.
Yeah, we talked about it. And
yeah.
With all those injections, you've got to expect a little bit of swelling. But I'm glad it settled quite quickly for you.
Yeah, and there wasn't any pain. You know, I didn't feel in pain afterwards. I know previously when I'd come before and had something in my temples and along my cheeks, both of those areas did feel bruised for a week or 2 afterwards.
So you're pretty comfortable, which is good.
Yeah, really, but it was really comfortable, yeah.
Good.
It was easy.
Now tell me, has anybody said anything to you, positive, negative? You let me know.
Yeah, I think I probably told most people I was coming anyway.
So you're not hiding
so it wasn't really much of a surprise to anybody. And I mean, it's just, you look great. You look really young. You look great. I think someone actually said to me last night, why do you have anything done? You look so young anyway. And I went, I look young because I've had something done. You've got it the wrong way round. If this was it normally, I wouldn't have anything done.
So people think you look natural.
Yeah, I think so. I don't feel that I don't. I feel my top lip might be a tiny bit swollen still.
Yeah, maybe.
But I think it's, yeah, I'm pleased with it.
Good.
I'm
really
really
glad.
pleased with it.
So going forward, is there anything that you would think about having done again?
Yeah, absolutely. I would really like to have some maintenance of the under eye thing, without a doubt. And the same with the cheek and the temples as well.
Yeah.
I mean, the Plasmage, I'm not sure if if I needed it, I definitely would, but I feel like it's made quite a difference, just one treatment.
So with Plasmage, you sometimes will require 2 to 3 sessions, but every session makes an improvement. So there's no requirement to go through with 3 sessions. If you feel like things are nice after one, then fine, we don't need to do it. But maybe we just wait a couple of months because the skin continues to contract for a couple of months after. Then we just play it by ear at that point.
Yeah. I mean, having said that, I am up for absolutely anything within reason.
Are.
So,
It's so easy to treat. So
yeah, I'll have that.
I'm glad to see you. I'm glad you have enjoyed your treatment. I'm glad that you feel more confident. And I just look forward to seeing you again in the future. Is there anything else you need to add?
I suppose I would just like to say that I found it really easy being there, even though you were doing things we hadn't discussed. I didn't feel panicky because you were very calming, and that was quite helpful for me. And we did the breathing stuff when you were going to do the injections and stuff, and again that kind of helped to know when the injection was coming and to breathe out when it was coming, to stop me getting in a flap
so
about
anxious,
it.
I suppose.
Yeah. So that was good.
Thank you. Okay, before we go, because you're now a TLC seasoned professional.
I don't like the sound of that.
You've been twice now. So we're going to show you your picture of when you first came, and then you can kind of compare it to what you see now in the mirror, okay? So have a look. Do you see a big difference from then to now?
Just a massive difference. Before I came, I didn't even think it was that bad before.
It was bad.
I mean, but now to just see how much fresher I feel and look, and actually I can really see the eyelids there and the under, in fact all of it. I don't even know where to stop. I can see a lot of difference, but nothing nothing says you've had so much stuff done. It literally looks like I've had a really good night's sleep and maybe a bit of a holiday.
My work here is done. Okay, thank you so much guys for watching this video. I hope you enjoyed it. Thank you to Charlotte for being a fantastic patient for the clinic. If you have any questions, just ask them in the comment section below. Remember to like and subscribe, and we'll see you in a couple of weeks' time for the next video. See you later.